Those of you that are familiar with social change in America know that it doesn't happen very often, and then it tends to happen in a rush. And you get a shot at it, and then it goes away for a while. So we got Medicare in 1964, about the time that the Canadians were 65. Oh, Steve's right about that. 65, the Canadians were doing their national health care. So we got the same thing for people over 65 that they got for the whole country. And we're still trying to fix that. By the way, I don't know if Larry mentioned that Tommy McDonald. Did you mention the important American connection to Tommy McDonald? He is Kiefer Sutherland's grandfather. So maybe we'll have an issue of 24 that'll be about single payer, and Kiefer can, you know, threaten a doctor to give health care to a patient and scare him into it. So anyway, I don't want to pick on Kiefer Sutherland, but he actually is the grandson of this guy who made Canada healthy. So how do we get this done? Because it happens in a burst, we pretty much have to do what we're going to do this year. And there's some good aspects to that, and there's some bad aspects. Dr. Reed did a nice job of laying out the song and dance that they give you when you go into the offices. How many of you organized against the Iraq War? Pretty much everybody, right? You're familiar with this song and dance because it's the exact same one you got then. Even our friends hold us a little bit off. Even the ones that we know really want to end the war don't really do it. They say some of the right things, they let you in the office, their staffers are enthusiastic, they'll get back to you, blah, blah, blah. And then when the key vote comes, which David was a leader on trying to cut off the funding for good in May of 2007, and we went from, I don't know, 180 votes to 8 or something. I mean, when the chips were down, everybody went for the half measure. And that's really, I mean, we're going to take this on, that's what we're up against here. So we have to be smart, we have to be firm, we have to be respectful and friendly. We don't really want to get into fights with our friends on this, because that's going to be a big temptation. Step one, what's step one of this? Well, there were 92 people that endorsed HR 676 last time. So we start with them. Let's see if we can get them back on. And you would think that'd be automatic, right? I mean, they were for single payer when George Bush was president. Surely they're for single payer when Barack Obama was president. We have even bigger margins in both houses. No, they're not. Many of them were for single payer when George Bush was president because they knew it would never pass. And so they don't want to say that to you. So you've got to kind of go in and remind them that they were for it 2 years ago, and slowly but surely build those 92 back up to the 92. Then you start with, in your case, the rest of the Virginians and your local people, because that's where you have the most clout. And you have 3 other people who could be important to this. Your 2 senators, especially Senator Webb is a very unique character in Washington. He's definitely not in the normal senatorial mold up there. And in this case, that might be a good thing. I mean, I don't actually know what Senator Webb thinks about single payer. The senators have not put their 2 cents worth in on any of this. They've been remarkably silent for the last decade, as if 50 million Americans were not missing health care, including many of their constituents. So we don't have a good list of senators, which is a bad thing for us, because we can't actually say you were for this 2 years ago in most of their cases. But your 2 senators could be important. You also have a governor who's the head of the Democratic National Committee, who's going to resist taking a position on this because he's the head of the Democratic National Committee. But on the other hand, he's both your governor and the chair of the party for the next year, which gives you a unique leverage over his comments. And you should figure out ways to use that. So after we get all the Democrats and the 92 that were on it last time. Then we moved to the next group. And frankly, this is probably the hardest part. Because we have a lot of friends that deep down in their hearts believe that single payer is the best thing to do, that have already chosen a half option. And we have to push past them without getting in a fight with them. Because the fight's not about whether they've chosen the right strategy or not. The fight's about how do we get health care to the most Americans in a decent way. But the truth is, many of the groups that have been for single payer in the past are now fighting openly to preserve a public option in the plan. Which means that essentially they've told management that they're willing to settle for $1 a year increase before they start it. And they're going to, I guess, be surprised if management offers $2 a year increase, right? That's the way it works, right? When you're in a union contract, you immediately tell them what you'll settle for as your opening gambit. No, of course you don't do that. But that's what most of our friends are doing right now on single payer. And what that means to us is the next 100 moderate/liberal Democrats that we might normally add to a good bill to cover their constituents for health care have another option. They can sign on for the public option, and they will tell us the single payer can't pass if you get in to see your congressperson in their district. And in truth, the 5 or 6 Democrats that Dr. Reed was talking about, at the moment, most of them, that's what they're going to tell you. And so we have to be clear with them that we want more than that. And we don't really want the insurance companies doing the health care.